Welcome to NASM CPT exam practice test. Our topic today is practice test. Use the link in the description to download the app on the App Store for free practice tests. Number 1. Which model of behavior change is dependent on the weighing of barriers to change and the perceived benefits of change? A. The health belief model. B. Trans-theoretical model. C. Theory of planned behavior. D. Social cognitive theory. The answer is A. The health belief model. Explanation. The health belief model is a theoretical approach in which the client must believe he or she can change, and the benefits of change are not outweighed by the barriers to change. Clients can be predicted to change based on their perceived seriousness of the negative consequences of their current state and their belief in a decreased risk of consequences as a result of change. Number 2. The most important predictors for behavior change, according to social cognitive theory, are the expectations of results and what other principle? A. Motivation. B. Goal setting. C. Self-efficacy. D. Extrinsic motivation. The answer is C. Self-efficacy. Explanation. Self-efficacy, an individual belief in one's own success, and the expectation of outcomes are the principles of the social cognitive theory. Motivation is a person's mental drive toward behavior change, and extrinsic motivation is the drive coming from an outside source, such as a change in appearance. Goal setting is a separate behavioral change theory that depends on the defining of personal goals and creating a plan to reach them. Number 3. What is the name of the plane of motion that divides the body into right and left sides? A. Sagittal. B. Frontal. C. Axial. D. Transverse. The answer is A. Sagittal. Explanation. The sagittal plane divides the body into right and left sides. The frontal plane divides the body in posterior and anterior portions and is also called the coronal plane. The transverse plane, also called the axial, cross-sectional, or horizontal plane, divides the body into superior and inferior portions. Number 4. Which is true of a client who has been determined to have moderate risk during risk classification? A. Doctor supervision during submaximal testing is required. B. A medical exam is required before vigorous exercise. C. The client has one risk factor. D. The client requires a medical exam prior to moderate exercise. The answer is B. A medical exam is required before vigorous exercise. Explanation. Clients who are deemed to be moderate risk require a medical exam prior to vigorous exercise. Doctor supervision during submaximal testing and a medical exam before moderate exercise are required only for high-risk clients. Clients with one risk factor are considered low risk. Number 5. Which of the following choices is an example of a synovial bicondylar joint? A. Elbow. B. Knee. C. Ankle. D. Hip. The answer is B. Knee. Explanation. The knee is an example of a bicondylar joint. The elbow is a hinge joint. The talocrural ankle joint is a hinge, and the subtalar ankle is a gliding joint. The hip is a ball and socket joint. Number 6. What muscles of the scapulothoracic joint are the major agonists when performing a push-up? A. Anterior deltoid, pectoralis minor, supraspinatus, and rhomboids. B. Serratus anterior, pectoralis major, biceps, and triceps. C. Anterior deltoid, biceps, levator scapulae, and trapezius. D. Serratus anterior, pectoralis minor, trapezius, levator scapulae, and rhomboids. The answer is D. Serratus anterior, pectoralis minor, trapezius, levator scapulae, and rhomboids. Explanation. The serratus anterior, pectoralis minor, trapezius, levator scapulae, and rhomboids are the major agonist muscles found in the scapulothoracic joint that allow the body to perform a push-up. The anterior deltoid, supraspinatus, and pectoralis major are all found in the glenohumeral joint. The biceps and triceps are agonists of the elbow joint. Number 7. Which of the following is a physiological benefit of beginning an exercise program? A. Enhanced feeling of well-being. B. Improvement in bone health. C. Better cognitive function. D. Decreased anxiety and depression. The answer is B. Improvement in bone health. Explanation. Exercise, specifically weight-bearing and impact activities, promote bone health and strengthening. Enhanced feeling of well-being, improved cognitive function, and a decrease in anxiety and depression are all psychological benefits of exercise. Number 8. What is the baseline recommendation for cardiorespiratory programming of moderate intensity? A. At least some moderate activity at least 4 days per week. B. At least 15 minutes per day on at least 5 days per week. C. At least 30 minutes per day on at least 5 days per week. D. At least 45 minutes per day on at least 3 days per week. The answer is C. At least 30 minutes per day on at least 5 days per week. Explanation. The baseline recommendation for moderate intensity cardiorespiratory training is at least 30 minutes per day on at least 5 days per week, for a total of at least 150 minutes each week. Although any activity is better than none, it is recommended that an apparently healthy person participate in aerobic exercise between 3 to 5 days each week, with a combination of moderate and vigorous intensity levels. Number 9. During the initial consultation with a new client, he states his current activity consists of training with resistance bands at home to a workout DVD and an occasional run in the evenings when he has time after work. What is this client's aerobic activity status and the associated training focus? A. Beginner. No prior activity. B. Beginner. Minimal activity. C. Intermediate. Minimal activity. D. Intermediate. Fair to average fitness. The answer is D. Intermediate. Fair to average fitness. Explanation. A client who has sporadic bouts of activity but no clear training plan are assigned the intermediate activity status. The aerobic training plan for an intermediate client is to focus on moderate activity and aim for 200 to 300 minutes per week, that is fair to average fitness. The beginner status with either no prior or minimal activity is assigned to those who are completely inactive or deconditioned. Number 10. Which of the following is not a major type of hypoperfusion? A. Obstructive. B. Hypovolemic. C. Destructive. D. Cardiogenic. The answer is C. Destructive. Explanation. The 4 major types of shock hypoperfusion are obstructive, hypovolemic, distributive, and cardiogenic. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.